In other videos, we discussed how too much facial fat can make a person look unhealthy, and having too little is a fast track to making someone look older. Fat has been demonized for decades, blamed on everything from soft jawlines to chipmunk cheeks. But then came GLP-1 medications like Ozempic, and suddenly we all saw what happens when facial fat vanishes, and let's just say, it's not pretty. Losing fat in the face is a form of premature aging, and we know this from the condition facial lipoatrophy, which was commonly seen in HIV patients. Fat is foundational and helps give our skin structure and softness, so we now have a newfound appreciation for it, and restoring it has become the new frontier in maintaining a youthful appearance.
We used to think aging was all about sagging and gravity pulling things south, but one of the biggest culprits of looking older is actually losing facial fat from aging, which is why fat has become the new fountain of youth. In past videos, we've talked about how much collagen we lose per year. We lose about 1% per year. After menopause, probably around 2% per year. But how much facial fat do we lose per year? Now, here's where it gets interesting. If fat is our secret weapon, the next question is, who's born with more of it and who's losing it faster? Turns out your face's relationship with fat is personal, down to your sex, race, lifestyle, and your hormonal landscape. So let's talk about the science behind what makes some faces age faster than others, and how you can prevent the loss of facial fat and how you can restore facial fat.
The amount of facial fat someone has tends to vary by ancestry. In general, East and Southeast Asians, some Native and Indigenous Americans, some Siberian, Finnish, Russian, and Sub-Saharan African populations tend to have higher levels of facial fat than other ancestries, with East and Southeast Asians probably having the most facial fat compared to all other ancestries. East and Southeast Asians, Siberian, Khoisan, and some Native Americans, Finnish, and Russians in general tend to have more facial fat to their cheeks and periorbital regions, or the area around the eyes. Whereas some Sub-Saharan Africans, especially West, Central, Southern, and some East Africans, tend to have more facial fat to their cheeks and their perioral area, or the area around the mouth. Sex hormones estrogen and testosterone have measurable effects on facial fat distribution, and facial fat is a hormone-responsive tissue. Estrogen promotes fat storage in areas like the cheeks, contributing to the softer, rounder facial contours typically associated with women. And while the lips are mostly made of muscle and skin, individuals with naturally fuller lips may also have some fat volume in and around the lips, so estrogen's effect on facial fat can help create the pillowy fullness we often associate with femininity. Whereas testosterone tends to decrease facial fat in the cheeks of men, and the less fullness someone has to their cheeks and midface, the more pronounced the lower face becomes. So this effect helps give men a more angular and masculine appearance. Fat also influences your facial morphology. The amount of fat you have in your face plays a big role in your facial shape. People with round facial shapes are more likely to have more facial fat, and having more facial fat contributes to giving faces a fuller, rounder shape. An abundance of facial fat tends to give people a more youthful, softer appearance. That's referred to as the baby face effect. And the more facial fat you have, the less visible your bone structure becomes, and the more it will soften your features and angles. Humans are born with a largely predetermined number of fat cells called adipocytes. This number is set during childhood and adolescence. In adults, fat cells generally don't increase in number. They just expand or shrink depending on energy balance. But there are exceptions to which fat will increase in number, which is what's known as hyperplasia. In cases of significant weight gain, like in the case of obesity, some studies suggest pre-adipocytes or fat cell precursors can differentiate into new fat cells, but this is much more likely to happen in larger fat depots, like the abdomen, rather than in smaller areas like the face. As we age, the fat pads in our face shrink, which make our faces lose volume. But what's striking is that while facial fat decreases or shrinks with age, the fat in our body doesn't behave the same way.
And that's because the fat in our face originates or derives from different types of tissue. During embryonic development, when we're forming in the womb, the face and the neck are primarily derived from neural crest cells, which are highly specialized stem cells. By contrast, most of the body develops from mesoderm, another stem cell-rich layer.
These fundamental differences help explain why facial fat develops differently, behaves differently, and ages differently. Facial fat is highly compartmentalized, plays a structural role in giving our faces contour, and it's more susceptible to being lost with aging, whereas body fat is more diffuse and generalized, serves as an energy storage rather than structure, and it's more responsive to caloric intake and metabolic changes and persists with age.
That's why when someone gets a facial fat transfer, plastic surgeons take fat from the body and transfer it to the face. Body fat tends to last longer and sticks around, and some surgeons consider the results to be permanent. We actually fairly recently made a unique discovery about facial fat. We've always known that our faces had fat, but what we didn't realize until the last 2 decades is that facial fat is organized into distinct compartments, known as the deep and superficial fat pads.
And each facial fat compartment can age differently. This was first discovered in 2007 in a groundbreaking study published in Plastic and Reconstructive Surgery.
This explains why certain areas, or even one side of your face, can be more hollow or look older than the other side, or why one cheek can be more deflated than the other cheek. And this changed the way the aesthetic industry approached rejuvenating the face. It shifted away from just lifting procedures to volume restoration.
So our facial fat pads have a unique function in providing contour and structure to our faces. And when it's abundant, it gives us a youthful appearance. And losing facial fat is a natural part of the aging process. In our early 20s, facial fat is at its peak. It gives the skin fullness and a soft glowing radiance. It's abundant, pillowy, and perfectly positioned. The fat pads sit close together, helping to create a seamless blend of one harmonious facial unit that reflects light evenly, leaving little room for shadows. It helps project the skin outward to give it a youthful contour. This is why a 20-something-year-old face looks 20-something. As we get older, maybe sometime between our mid to late 20s to early to mid 30s, our fat pads shrink, and some people may like how their faces look because the loss of some fat will give our facial features more definition. In our 40s, we have more prominent fat loss in the temples, under the eyes, the mid-face, and the lateral face. And in our 50s and beyond, you have an accelerated loss of both the superficial and deep fat pads. And when this happens, the tissue shifts downwards and forward. So how much facial fat do we lose per year?
There are a few articles that talk about how much facial fat we lose per year.
One article in Harper's Bazaar claims we lose 3 cc's of facial fat per year, and according to Clinique, we lose 1 teaspoon per year, which equates to 5 cc's of fat per year.
Just to give you an idea of what a cc is, cc stands for cubic centimeter, and it's the same as 1 milliliter. In aesthetics, we often use syringes measured in milliliters, so when I say 1 cc, we're talking about the amount of product in 1 standard syringe of filler. Now, I'm not sure where or how these articles are coming up with this amount, and I tried searching online to find any study that could support that we lose 3 cc's of fat or a teaspoon, which is 5 cc's of fat per year. And after doing an extensive amount of research and speaking with a research scientist who works in this aesthetic field, their estimations of yearly fat loss seem to be educated guesses. But I did find one study that quantified the amount of facial fat loss over 11 years, and that was featured in Plastic and Reconstructive Surgery in 2021.
They studied 19 individuals who underwent CT scans of the head to measure the amount of facial fat loss, and their BMI stayed the same over this 11-year period.
So we know the fat loss to their face wasn't from dieting or losing weight, it was from aging. In this study, they measured changes in the fat deposits to the mid-face over time, and the results showed a definite and measurable loss.
The study showed that we have more superficial fat pads, which made up the largest portion of mid-face fat, followed by deep fat and then buccal fat. Also, the rate of fat loss was different between the superficial and deep fat pads. Researchers found that we lost 11.35% from our superficial fat and 18.4% from our deep fat, but the buccal fat loss was not statistically significant.
I found this interesting about the buccal fat because in the video about facial fat and attraction, we discovered that our buccal fat behaves differently from the other fat on our face. The buccal fat behaves more like the visceral fat on the body, which often persists with age. So from this study, we know that the deep fat pads are more susceptible to age-related volume loss than the superficial ones. And that's important because deep fat plays more of a structural role. It acts as a foundational support for the mid-face, helping keep everything lifted and in place.
So the total mid-face fat volume loss equated to a total of 5.6 cc's over 11.3 years.
If we were to calculate the yearly loss of fat from what we know from the study, that would equate to around 0.5 cc's or half a cc of fat loss per year. So a half a cc contradicts what those articles claimed. But the thing is, this study only measured fat loss to the mid-face region. So since the study only analyzed the mid-face fat loss, we need to try to estimate how much additional fat loss occurs to the other areas of the face. We have to account for the upper face, the forehead and temples, the lower face, the jawline and chin, and the preauricular area, or the very back area of the cheeks. So with what we know from this study, we can take an educated guess with the help of AI in estimating the fat loss per region of the face so that we can hypothesize or make an educated estimate as to how much fat we lose to the entire face.
If we take into account the upper face, the lower face, and the mid face, which we actually have the real data for based on the study, that estimates us to around 1.5 cc's of facial fat per year.
This estimate is not a definitive scientific measurement, but an educated guess based on the study and the known fat compartment anatomy. So to conclude, it appears that we would lose around an average of 1.5 cc's of facial fat per year.
That would look something like this. This is a 3 cc syringe filled to 1.5 cc's, and this is not fat actually, but it looks like it. It's actually the extracellular matrix of fat.
Of course, the numbers only tell part of the story because the rate of facial fat loss isn't just about time. It's also heavily influenced by hormones.
Estrogens play a crucial role in regulating adipogenesis, or the formation of new fat cells. We discussed that estrogen enhances softness and convexity in women's faces by forming more fat to the cheeks. But in addition to the cheeks, it also helps fat form to the temples, and it plays a key role in maintaining our facial fat. And when estrogen declines with menopause, it'll speed up facial fat loss in women to these areas, the temples and cheeks.
So I've begun telling a lot of my patients to really consider hormone optimization therapy for menopause and even perimenopause because estrogen has an effect not only on our collagen, but also our facial fat.
So who gets hit the hardest with facial fat loss? People who are thin, especially those with delicate facial features, those with less dense skin that have less facial fat to begin with, and people who have low body fat and are lean like athletes. You know who else gets hit hard? People who are losing weight with GLP-1 drugs like Ozempic. These medications have revolutionized weight loss, but they've also introduced a lot of new challenges.
Now, if you're in your 20s and you lose weight, you may not notice any negative signs of aging because your facial fat is still abundant.
But what research has found is that the superficial fat compartments seem to be more affected by weight loss from GLP-1 drugs, and we don't fully understand why.
What we do know is losing facial volume after weight loss is most significant in the mid-face region. And the mid-face region plays a significant role in maintaining a youthful appearance because it acts as a central support structure for the entire face.
And losing fat in this area can lead to a cascade of aging effects like under-eye hollowing, drooping of the facial tissue, deepening smile lines, flattened cheeks, and jowling. In a small study that included 5 patients receiving semaglutide, showed an average of 41.8 reduction in the superficial temporal fat and a 69.9 mean reduction in the cheek fat pads.
So let's talk about the pros versus cons of having an abundance of facial fat.
The pros or benefits of having more facial fat reserves is that you'll retain more facial fullness, which helps keep your features looking soft, and you'll be less likely to have fine wrinkles. But the cons of having an abundance of facial fat is that you'll be less likely to have definition to your facial features. This is why people who have an abundance of facial fat to their cheek region, especially the lower cheeks, have sought out procedures like buccal fat removal. When they remove some of the fat from this area, they'll have more definition to their faces. If you have an abundance of facial fat, you're also more likely to fall into the facial aging category of sagger, because the thicker your tissue, the more likely it is to descend with time, especially if you gain weight. And if you're overweight, it can be a lot more challenging if you want to avoid a facelift. This is why understanding the differences in the variation of skin thickness is paramount to which anti-aging treatments and procedures will work for you.
It's also why if someone is overweight and they're considering anti-aging treatments with injectables, I prefer them to lose the weight. If you lose the weight, your tissue is less likely to sag or descend. And even though you're still going to age, it's easier to give the skin tissue support with injectables if they lose some of the facial fat because that makes the skin heavier.
The pros of having less facial fat is that your face will have more definition and you'll be more likely to fall into the facial aging category of sinker, which means your skin tissue is more likely to sink in and less likely to sag, which is a big plus if you're trying to avoid a facelift. But the cons are that people who have less facial fat, especially those who are very lean like athletes or people who are underweight, they generally look older and show the signs of facial aging faster than individuals with an abundance of facial fat.
Whether you're dealing with too much or too little, one thing is clear. Preserving facial fat is part of aging well. So let's talk about what accelerates fat loss so that you can avoid premature aging. You want to avoid smoking and excessive alcohol. Both accelerate aging by compromising circulation and collagen integrity, which can impact the structural support around facial fat. And while it goes without saying that smoking and drinking aren't doing your skin any favors, one thing I can't stress enough is being mindful of sun exposure. What counts as excessive really depends on your skin type. Some skin types can tolerate more sun than others, but everyone has a threshold. UV light impairs fat cell function, which leads to reduced fat storage and potentially increased fat loss over time. Also, if you're trying to lose weight, especially if you're doing it with GLP-1 drugs like Ozempic, avoid rapid weight loss. Losing weight gradually won't stop facial fat loss, but it can give your skin more time to adapt. Rapid weight loss, on the other hand, doesn't give the skin or underlying tissues time to adjust, and this makes the volume loss appear much more sudden and pronounced. You may want to also think twice about who is doing your laser devices like Morpheus, Ultherapy, or any other radiofrequency device, because there have been so many people who say that these devices ended up causing them to lose fat, which ended up making them look older. This is exactly why I really try to rely on regenerative or biostimulatory injectables when I really want to build up my volume and fat equity. There's no risk of volume loss with injectables as opposed to devices. I personally can't take the chance of losing fat. People have also asked me what I think of topical products like Volufiline or Adipo, which are said to restore facial fat loss. So I did some research on both these products, and there was apparently a small internal study. It wasn't published in any scientific journal, but it was mentioned in Who, What, Where. 20 subjects who applied Volufiline to one breast got an average of a 2.2% increase in breast volume. 2.2% increase is barely anything. I haven't personally tried these topical treatments because at the end of the day, these are topical treatments. How much volume are you really going to get with a topical product? How would it penetrate that deep into the skin to restore these deeper layers of fat? Topical products like Adipo and Volufiline may target dermal adipocytes, the fat cells located within the dermis, and someone may notice an improvement to the under eye area by using these products because the under eyelid skin is much thinner compared to the other areas of the face, so the product probably penetrates better to this thin area. But even if Adipo or Volufiline can stimulate dermal adipocytes, their effects are largely surface level and wouldn't impact the deeper layers of fat that we've been talking and referencing about in this video. The loss of these deeper fat pads, the superficial and the deep fat pads, are what causes sunken cheeks, hollow temples, deep nasolabial folds, or smile lines. So what are ways that we can actually restore these deeper layers of facial fat? There are more invasive procedures like fat grafting or facial fat transfer, which is a surgical procedure where surgeons harvest fat from one area of the body and inject it into your face. The harvest site is usually the abdomen, thighs, or flanks. After a facial fat transfer, patients can look extremely swollen and overfilled in the beginning.
This was actually the rumor with Madonna. When she looked dramatically different, some blamed it on filler, but others speculated she had undergone a facial fat transfer and stepped out into the public too soon because she seemed to look more natural as time passed.
So fat grafting can be a great long-lasting and possibly even permanent way to get your facial fat back. But it is a more invasive procedure that not everyone will want to undergo. Also, what if you're very lean and thin? It may be harder finding areas of fat to harvest. I personally wouldn't want to have this procedure done, but there is another non-invasive proven way to regenerate fat, and it's an injectable called Renuva. So how does Renuva work?
Our facial fat isn't just sitting under the skin. It's woven into a honeycomb framework called the ECM, or extracellular matrix. So Renuva is made of this ECM, or extracellular matrix of fat. But Renuva does not actually contain any fat, just the extracellular matrix of fat.
So when you inject Renuva, it works by signaling your body to regenerate its own fat to the area that was injected. It's the first ever off-the-shelf fat graft alternative. No liposuction, no downtime, except for temporary swelling. And I've been testing this product out on myself for the past 8 months, which is why I stopped doing my Sculptra. I haven't done Sculptra for over a year and 3 months now, and so far I'm seeing great results. But I need to treat more areas of my face. As with all types of regenerative treatments, it usually takes a series of treatments to build up the targeted element that you're aiming to build. In this case, it's fat tissue. So Renuva has become my newest obsession because it restores fat, and fat is one of the most youth-giving tissues. Traditional hyaluronic acid fillers do a fantastic job of adding volume to the face, and they're immediate, but fillers don't restore or regenerate what you're actually losing, which is facial fat. Renuva is about as close to a golden anti-aging injectable that I think we've got right now because it stimulates actual living tissue. As of now, this product is the only injectable that's been clinically proven to stimulate adipogenesis, which is the process of creating new fat cells. And if you want to see my results and learn more about my journey, be sure to check this video out.